the most important message is that we need to do two things. One is continue to focus on what I call the patient in front of us, the provider aspect. Continue to make sure that we deliver high quality care to the patient in front of us, then to the patients on our list, and then the patients in our community. And the second important message, I think, is that commissioning is happening, and we welcome and support our GP colleagues who are doing it. But we can't expect commissioning to sort the world's problems out. It hasn't in the past, but equally, we're doing well. And I think it's important that we continue to realise that and to work with our clinical commissioning colleagues.
Dr. Buckman talks about it being a minority sport. How do you get from it being a minority sport to something that more GPs are enthusiastic about?
You know, right from the outset, we said that good commissioning is about being a good general practitioner. It's about understanding how you use resources effectively and efficiently in the consulting room. I think that the vast majority of GPs are good commissioners. They do it in their consulting room. I'm not expecting all GPs to leave their consulting room and go and sit on clinical commissioning boards or on committees. Otherwise, there won't be anybody left to see the patients. I think, as the college has always said, this will bed down to a minority doing commissioning at a leadership level, but as long as we make sure that we've got the next generation to take over and we have succession planning well in place, I'm not that concerned about it being a minority sport. What has to be a majority sport is being a good clinician in the consulting room.
You talked about the idea of peloton leadership. Perhaps you could explain how you envisage that working.
I am getting increasingly anxious about people talking about transformational leadership or revolutionary leadership or dysfunctional innovation. And it made me think, actually what we need is peloton leadership, us all working together and let the force of the group working together lead for the benefit of our patients. GPs are leaders, we're all leaders, and the idea that there is this extraordinary leader, this Churchillian leader, I think means that most of us think, well, I'm certainly not one of those, so I might as well not even try. What we need is what I phrase the peloton leader. We work together in a group to make things better for our patients and our communities.
And from this morning, how do you think the RCGP can change to bring about the sort of things that you'd like to see?
Well, we are already. We have our 2022 vision for general practice, which we've been working on, which went to council, is going to next council, and then an action plan. It works on the premise that if we have more GPs spending longer with their patients and their communities with longer training, then GPs can deliver a sustainable health service and can change what they're doing. Change in an iterative, evolutionary way. So, for example, for micro teams within their practices, look at how we can deliver 24 care to those that need it, not to the whole group, but those that we have identified as being at high risk for admission, such as some of our chronic complex patients, those at their end of life. And also looking at how we can use technology better, so use the telecare, telehealth, and how we can deliver continuity of care in a better way. So the college is working very hard on the issues that have been brought up. I have asked two things of the National Commissioning Board and Monitor. The first is that they start monitoring what's happening in general practice, because I get very annoyed that the success or failure of the NHS is always predicated on waiting times for operations or numbers attending A&E. We need to start actually having measures as to how hard GPs are working and how complex the care. So that's the first thing. And the second thing I really would ask for is what we call a staff college, but a leadership programme funded nationally for all GPs at certain pinch points in their career that is integrated with other professional groups, but that we have those leadership opportunities right from qualification to retirement.
And you appear to have had some success in getting at least
a discussion. I've had some success in getting a discussion.